Hello.
No, you're fine.
Yes.
Hi, you're fine. Hello.
That made me super happy that I actually wanted to work for us.
I know, it was actually seamless, which is surprising.
Perfect.
Okay, I'm going to share our live with all the pages. Hi, Mac.
Perfect. So weird seeing myself on the computer talking while I'm trying to share
it's always
this with you.
it's always really trippy. And also, like, there's always a lag. So it's like I see myself doing things, I'm like, oh no.
Hi, Mackenzie.
I also feel like I try not to double share it to a page, but I always end up accidentally doing it.
That's cool.
Okay, last one. Alrighty. What is up, everyone? So, Michaela and I, aw, Kenzie. So cute. Okay, I need to make sure I can read my computer screen because I like wrote things down. Michaela and I are going to be discussing HIV Testing Day, and if anyone saw, Alexander and Cheyenne also did a little HIV Testing Day discussion because HIV Testing Day is tomorrow, so it's kind of what everyone is talking about today. So yeah, we're just gonna like have a little discussion, go over some HIV like basics, but for some people it might not be basics. It might be like your first time learning about HIV. And then afterwards, we're gonna play a little myth fact, and yeah.
My favorite.
Okay, so
So many myths
I'll
out
start
there.
out. Huh?
I said so many myths out there.
I know, for real. There are, and some of them I feel like I didn't even, like, you don't even realize how many myths like you believe that you thought were a fact until. Hi, Shy.
Hi, Cheyenne.
So yeah, Shy and Alexander like just had a discussion about all this, and I was writing what I was gonna say, so I missed the conversation. But if you guys have things to add, please comment and add on to our discussion.
Always.
Yeah. Okay, so HIV Testing Day, I got this directly from the website hiv.gov, which is an amazing resource for anyone who doesn't already know about it. It had all the testing day. It has like definitions. It talks about what HIV is. It talks about PrEP and PEP, and I'll talk about that. And I got that from the same website. So it's a really good resource to have, and isn't like, sometimes government websites can be so like hard to read and hard to follow, but I feel like this is really like spells everything out really nicely and easily. So first observed on June 27th, 1995, National HIV Testing Day, or NHTD, is a day tested for HIV, know their status, and get linked to care and treatment. The 2020 theme, which I didn't even know this, is Know It. This is new ways to take an HIV test and reflects that we can continue the momentum toward ending the HIV epidemic. A plan for America that they're taking to end the HIV epidemic, because absolutely is an epidemic, but it is preventable. Knowing can mean knowing about treatment options and understanding prevention options, including PrEP, which is available through the Ready, Set, PrEP program. So that's like the official program that HIV.gov, like as an organization, has. So yeah, so it started in 1995, and I'm really bad at math, but I think that means that it was like 25 years ago.
You got it.
Right?
You're not bad
I
at
think.
math. Come on, girl.
I'm really
yes.
bad at math. That seems really, and I didn't even get that by subtracting the years. I literally took my own age and was like, okay, if I was born this one, yeah. But yeah, okay, 25 years ago.
Do it your way. 25.
Yeah. Okay, yeah. So, yeah, so that's really amazing that we still have, well, of course we still have HIV testing today, but that this has been going on for 25 years. And I feel like if we were to look at the evolution of testing and how people get tested, we would see that every year it's becoming less stigmatized, it's becoming more accessible and easier to get tested.
Oh, yeah, I'm pretty sure you used to have to wait. I mean, I'm going to say a month, and I'm going to be comfortable with that. But it used to take a long time to even know, like, to get the test back even once, you know, they first started testing people. And now to think you can wait 20 minutes and have a potential answer to go forward with is incredible. So, yeah, it's crazy.
Yeah. And then to have treatment options, because back in the day, like, and that's what I'll talk about in a second when I talk about what HIV is. Like, back in the day, there were such few treatment options because it took so long to be done on HIV. A lot of options out there, and like it started off with virtually no treatment options, so someone got HIV and it was seen as a death sentence. But we've come so far, and that's not the case at all. Spoiler alert for when we do miss fact. But so for anyone who doesn't know, HIV stands for the human immunodeficiency virus, and I'm actually taking all of this directly from like how we teach HIV in school. And HIV is the virus that causes AIDS. So a person who has HIV does not mean that they have AIDS. And nowadays, most of the time, HIV doesn't even get to the stage where it is AIDS. So it's a virus that causes AIDS, but they're not the same. And then people who have HIV in their bodies are said to have HIV or to be HIV positive. So if someone says that they're HIV positive, they're just saying that they have HIV, and it's just one part of who a person is. HIV works by damaging. No, yeah, go ahead.
That's just a really, really good point, and something that I've noticed just that people don't really say AIDS anymore. And it's kind of gone out of the language a little bit, and that is, like you said, I didn't really put two and two together, but because it doesn't develop that far, people don't get that sick as often. But I think it's just really important in our language, you know, that we keep reminding, you know, it's a better way to say, you know, someone has HIV or they're HIV positive, whatever they prefer. But yeah, I haven't heard anyone say, you know, that person has AIDS in a while. So I think that's important, just to like, it's just interesting.
Yeah, and they're very different things. So so HIV damages the body's immune system, which is normally the system in the body that protects you from diseases. So the immune system becomes weaker until it can no longer fight off different types of infections. So this is what happens if HIV is in the body and it's not treated. So eventually what would happen is your immune system would break down to the point that it can't fight off certain diseases, and that's when HIV can progress to AIDS. And then when a person dies, they don't die from AIDS itself, they die from those opportunistic infections that break the body down. But that is only in cases where HIV is not treated. So that brings me to my next point, which is that there is no cure for HIV. So it is incurable, but treatments can be started while the person is still healthy. And with these medications, people with HIV can lead long and healthy and otherwise like completely normal quote unquote lives. So like we said before, HIV is not a death sentence. It's a virus and it's manageable. It's not curable, but it is manageable and it is treatable. So how does a person who what are some treatments? So, well, I'm not going to get into like the specific treatments that people who have HIV take, but there are medications within the realm of like HIV medications that people who don't have HIV can take. So the main one is PrEP, which stands for pre-exposure prophylaxis. I think I said that right. I really wanted to say it right.
I think so too. I know it's a weird one.
Yeah. And it's a daily pill that someone takes to prevent HIV. So this is a pill that someone takes who does not have HIV but might be at risk for whatever reason. And we know that it's not certain people who are at risk, it's certain behaviors that makes a person more at risk than another person. And
Really
if you go to hiv.gov, if you go to hiv.gov and you look up PrEP, it will actually like break it down. Like, are you a person who might consider going on PrEP? And it can be very expensive, but it is covered by most insurance companies and it's covered by Medicaid. And if someone doesn't have insurance, so that's the thing is like, PrEP is really expensive, right? But if someone does not have insurance, there are programs that can assist with costs, and that's a conversation that you can have with your healthcare provider. They can get you in touch with these programs that can help take that burden away. And hopefully, now that PrEP is becoming like something that a lot of healthcare people are talking about, like we talk about it, and it's becoming more commonplace, hopefully soon it'll be way more cost effective because every single person deserves the same chance to protect themselves, you know?
Yes, absolutely. And I think that's really, really a good reminder that a lot of different types of medications do have programs like that. And it's just so important to talk to your doctor or talk to even somebody like us who we can try to connect you with somebody if that cost and that insurance piece is the reason why you're not seeking out service, because there's just so many, there's just so many options of ways to help people. Yes, absolutely. Everybody deserves the same chance at these medications. So yeah, really good point.
And like you said, we wouldn't want to hear that someone is just automatically is writing it off like, well, I can't afford that, or someone who just think that they're a person who needs PrEP, but then say you like go and you look through and you're like, oh, like maybe I checked some of these boxes, like maybe it's something I should start on. And we can definitely help with that, even if it's like finding a program for you, even if it's not like something. There are some things that like OCO specifically can't help with, but we can always help you like get to those resources. So good point. The next one that people should know about is PEP. So there's PrEP and PEP, and PEP stands for post-exposure prophylaxis. And this is a series of medications taken after you have been exposed to HIV, you think you HIV. So it's almost like a HIV Plan B pill. That's like, I think a lot of people are familiar with Plan B, so it works similarly. And you must start it within 72 hours of exposure. It won't, like, the sooner the better. On the website, it literally says like every hour counts. And this should only be used in emergencies. So just like when we talk about Plan B, the emergency contraceptive pill, you know, that's not a birth control pill. That's just for emergencies. PEP is the same way. And in cases where someone might take PEP, this could be having unprotected sex. It could be like you did make a choice to have unprotected sex, but it could also be that you had sex with a condom and the condom broke. It could be someone who shares needles or works. It could be someone who accidentally has come into contact with another person's fluids, or it could be someone who was sexually assaulted. So these are all circumstances when someone would take PEP. I believe they will give that to you like I know that I specifically heard, like, in the case of if someone has been sexually assaulted, if you go to, like, the hospital after that, like, PEP is something that they'll give you as part of that process.
Yeah, I would say that if anybody feels like that's something they might want, or they come across a situation that, especially if sexual assault is involved, that is something the ER should provide. But I would encourage them to also contact SAFE if they needed help
Yes.
advocating for themselves
Yep.
for that medication. But yes, it should absolutely be provided to you if you go to an emergency room in a situation like that. Yeah.
Yeah, but 100% good point. SAFE is definitely the OCO program who can help out with that. Okay,
We all work
so
together.
now, yes, we do. Okay, so now do you want to talk a little bit about like the actual testing process and like confidentiality and all
Yeah.
that?
Yeah, I'll talk about, I wrote myself a little note. So I was gonna just first tell people, like, if they wanted to get tested, how that, how to come into contact with that, basically. And it's a little bit different now, obviously, like everything else is. Right now, if you want to get HIV tested, call one of our health centers, or you can text to make an appointment. You can still reach out to one of our advocates, educators, and they can help you make an appointment. But that's the only place that we're doing the testing, and for now. Sometimes we're out in the community doing free testing, and people can access it that way. So sometimes, normally it's a little bit easier right now if it's something that you really want out that way. The basics of the test that we usually do. So what we use in our van, doing testing, which we love being out in the van. Just want to say I miss sitting outside with everybody.
I miss it so much.
We use what's called a finger. Right? I know it's funny because like I feel like when we were doing it, it was just whatever, and now I'm like I would give anything to just be out in the sunshine.
I know.
With my awesome coworkers. Yes. So what we use is called a finger stick test. So it is a small needle. It just like pricks the tip of your finger, like when you're at the doctor's and they test, they just need a droplet of blood. That's basically what we're getting, is a few drops. But so I'm just putting that out there that that's what the test is. We used to have a saliva one. That one is just not quite as accurate. And we don't, this next generation test, which was the finger stick one, came along. So we use that. There's nothing wrong with the saliva one, but the finger stick one's a little bit more accurate. So that's what that is. But basically, we are a confidential testing center, so we're not going to share your information with anybody. We are not going to bill your insurance for this test. We are not going to send you a letter home saying thank you for getting HIV tested with us. But we are not anonymous. So that means we are going to collect your information. Some of that is for demographics. Some of that is for the New York Department of Health, because we track and trace people that do test positive for HIV just for public health safety reasons, not for anything punitive or stigmatizing. But, it does, sometimes it seems to feel that way when people are asked, if they've tested positive. But it is exactly like what they're doing now with the COVID testing. It's the same exact thing, like they're literally just trying to see who's come into contact with who in such a way that they could have contracted this, in this case HIV. So we will gather your information. This test, so basically I would say if you're going to come and get tested with us, you want to set aside a half hour to an hour. It usually only takes about a half an hour. 20 minutes of that time, the test needs to cook like a pregnancy test. It has to follow directions and sit for a certain amount of time. So we can't speed it up or slow it down or anything like that. So basically you're going to come in, you're going to fill out some paperwork. We're going to make sure that you understand the testing and the information that's going to be given to you. You do have to stay and get those results in person. So if you've got 5 minutes and you can get your finger pricked, but you've got to run to work. You know, we can't call you later. And part of that is the confidentiality. So these results are for you. And even if you wanted somebody else in the room with you, we wouldn't be able to do that without a whole bunch of extra paperwork, or probably not even. You know, even if it's your girlfriend, your mom, like whoever, the confidentiality of this is very, very serious. It goes even another layer above your normal just medical privacy that you have, which we usually just call HIPAA, those laws and rules. The confidentiality of HIV is even a step above that. So, and that covers you just getting tested for it. That's confidential HIV information. So that should not be shared with anybody, even if you tested negative. So just keep that in mind, you know, that the people that do the jobs to do HIV testing, we take that very seriously. And that shouldn't be a concern, and we can talk to you personally more about that if you're worried about that when you come to get tested. But we don't share who comes and gets tested. So whoever's getting tested, treated, or who's been exposed to HIV even, that is still covered under confidentiality. So if your boyfriend told you he was HIV positive and you come to us to get tested and you say you were exposed, that's confidential information. We're not going to share that with anybody. And we are really going to respect that no matter what your age is. And if you maybe went and got tested at like your primary care doctor, they wouldn't necessarily treat it the same way because they can still talk to your parents. So those are just like important things to keep in mind of why, when and why and what you might want to do to get tested. But so you would come fill out paperwork with us. We will, again, make sure you're understanding everything. We're gonna do a quick finger stick on one of your fingers, and set the test. We take the blood, set the test to the side, and let it cook. And what the test is looking for is antibodies and antigens. So that it's kind of looking for any signal that your body is fighting off a really serious viral infection. So we do kind of just remind people, like, you could, if you get a false negative, there's no false negative. If you get a negative, there's nothing in your bloodstream that we're finding that's indicating that you have an HIV infection. But if this quick 20-minute test is positive, there are things like mostly that people would know they have, like a late stage cancer or like a herpes outbreak. So something where your immune system's already kind of revving. It could say, you know, this test is reactive, because we don't really call the tests that we do on the van positive or negative. Sometimes I start using that language because that's what people know, but really what we look for is a non-reactive or a reactive test. So if you get a non-reactive test, like I said, there's no false, that's a negative, and within the time frame, and I'll talk about that in a minute. But if you got a reactive test, then what the process is, and this is completely up to the person, by the way. So you can just take that information and go forward with life, and maybe choose later to come back and see if that was an HIV infection or whatever. But our advice, or what we would suggest people do, is go get more blood testing. So that would be when they take, you know, a vial of blood from your arm and they test it and they can see more of what's going on. So that would be the next step for somebody that had like a positive or a reactive test from us. And then that's when they would be referred out into other places, like we were saying, for treatment and for services. So, but they've given us the consent to test, and they can take that back at any point. You don't have to wait for your results. You don't have to do anything you don't want to do. But what that finger stick test is testing for is anything before 2 weeks ago. So if somebody came in and they had sex yesterday, I'm not going to be able, the test isn't going to be able to tell. It's not going to be reacting at, your body hasn't, your body's just not going to show it on a test yet. But anything from 2 weeks and before, we will know. So we tell people, you know, if somebody comes in and gets tested once a month and they
Mm-hmm.
have, you know, multiple sex partners, or they just think they may be at risk or whatever, that's a good time frame to go
Okay.
on. But yeah, so that's basically the time frame we're looking at, is 2 weeks and before. Like I said, everything that we cover with you in the appointment is confidential. Any questions you ask, anything that goes on, completely confidential. And I think one thing I was kind of thinking about in that we were talking about was, you know, why, because we hear a lot
Mm-hmm.
about people telling or not telling that they have HIV.
Mm-hmm.
So, you know, why might somebody not share that information when they know that they have a positive test?
Mm-hmm.
So, I mean, my thinking is, you know, people are scared. We're, you know, just
Definitely.
even talking about it now, it brings up emotions, or you know, people, the diagnosis still is scary, even as we tell people that there's treatments and that they're successful. So I think that is definitely a part of it.
Mm-hmm.
And I know, like, people get hurt because of these things too. People's lives can be at stake, so it's not always as simple as just expecting someone to share or not share information. But I do like to remind people that someone does not have to tell you their HIV status. It may be in movies, it may be in the TV shows, but the laws that we have really protect that person with the HIV status, and those are there for a reason, because there's been so much histories of crimes and violence when those laws aren't in place. So, you know, there's a reason that that's how it is. But yeah, I mean, I'll just put it flat out there, like, someone doesn't have to tell you before they have sex with you if they have HIV. You can sue them for not doing that, but I mean, I could sue you, Hannah, tomorrow for not telling me I looked pretty on this live. You know, like, I can, if I have money, I can just sue.
Yeah.
So I think sometimes people forget, like, they can be held responsible in some way, maybe, but as far as, you know, did they have the intent to harm you and hurt you when they did that? Yes, it's on Law and Order, and but it's not something that actually happens very often. But I think that the really important piece of that too is all the fear of the HIV, when really, you know, they didn't give you a deadly virus. You know, we know at this point that it's like medically manageable. It's a medically manageable condition. That's how it can be named. It's not life-threatening. And so that's kind of where that has gone, I think, gone downhill. I mean, again, when we were talking like 25, 30 years ago, this fear was very, very real for people. And it was all over the place, and probably even more dangerous at that time to speak and say you had HIV because of that. So, you know, nobody's got to tell you their status before they have sex with you. But, you know, that's another reason why it's so important to have conversations. And if you say, well, I asked him and he said no and I didn't trust him, let's have some further conversations about what's going on with that relationship. Rather than, So.
Yeah, and I think that people get hung up on this idea of like, oh, well, what are the laws? Like, doesn't someone have to tell someone? And it kind of gets into this cycle of like trying to criminalize people who are HIV positive, when historically we know that people who are HIV positive are the ones who are getting the most violence against them. So, like you said, it's definitely sensationalized. It's in the media. It's in Law and Order. I can like definitely think of like myself when I was younger. Like, what are the only things I knew about HIV? It was like, well, for one thing, the musical Rent, which I was obsessed with, which isn't even like a necessarily like a bad representation.
We should have started with that.
Yeah.
No, it's not. It's power all the way.
So there's that, but then you look at like Law and Order, and it's like these ideas that like like a person with HIV is like purposely, maliciously going and trying to infect someone. And like, for like you said, like that's incredibly hard to prove for one thing. For another thing, it's just not true. That's just not what's going on.
Yes,
And
it's
there are
not
lots of
accurate.
reasons why someone, yeah, there are lots of reasons why someone might not disclose their status, and a lot of that has to do with stigma. And
Yes.
and that's not to say that we're saying that it's okay not to disclose if you are going to have sex with someone. You should be telling people this. And this goes for, you know, we like to separate HIV from like other STIs, but really, like HIV is an STI.
Yeah.
You should be talking about your status and getting tested no matter who your sexual partner is. And that like mutual sharing is really important when it comes to disclosure, because if you're a person who's HIV positive, for example, and you're nervous about disclosing, it's equally important to your health that you ask the person that you want to start a sexual relationship with, well, what's your status? Like, when was the last time you were tested for HIV or any of the STIs? But I think it really, really, really comes back to stigma. And why are we so afraid? Like, a person who's afraid to disclose their status, like it all has to do with stigma. And really, if someone is approaching the subject thinking like, well, how can a person get punished for giving someone HIV? It's like, let's flip the script and kind of be like, what are ways that we can facilitate this conversation, make it easier for people with HIV to tell people? Because that's really all about knowing. Like, the whole theme of HIV testing day, like this year, how it's about like knowing, that is totally has to do with stigma. The stigma of reducing getting tested, you know, like, even though stereotypically we might think like, oh, like a gay man or someone who has sex with other men, like they're the ones who need the testing. But really, it's like everyone should really get tested. I mean, it's not, there's no harm in getting tested, and it's about like normalizing it, knowing your status, and sharing that information with others. And then that's a case where PrEP then comes into play. You know, like if your partner is HIV positive, like there are so many cases. I don't think we talked about this, but when someone is on medication, someone who's HIV positive, when they're on medication for a certain amount of time, their viral load can get so low that it can be untransmittable. It's like the U equals U, like what is it, like undetectable equals untransmittable. So their viral load can get so low, yeah, that like they can't even detect the virus in their bodies, and it can't be passed to someone else. So really, like, we've come so far that like it doesn't need to be like this big like secret, or like this big like scary cloud over society, like, oh, HIV. It's just another thing that people live with.
Hi, Sharon.
I
I
my
miss
mom
being
is
in the
on.
office with you. Yes, I was thinking of so many things when you were talking. I was thinking about what you said about the media is like, hello, there should be a documentary just about representations of people with HIV, because
Absolutely.
yes, these are the representations we see. The person that's so angry that they've been diagnosed and they're going to go infect others. And that was largely probably the narrative in like the 90s, and or how it was portrayed in the media, or it was portrayed as sex workers, people using needles, and that was totally not the language they were using then. So
No.
so it's crazy, but I think that really kind of hits the nail on the head. And I was thinking too when you were talking, I think it's just representation. As people become more comfortable sharing that they have been living with this, or that they are living with it, or just that they're getting tested, you know, I hope that we'll see it just more and more normalized, or whatever, just the stigma to be taken out of it, because I think that's, I mean, definitely a big reason.
For sure.
And I was thinking too, that, you know, that's some of the reason that we have some of these laws that we have, is because when people started originally getting sick with this, nobody would even take care of them. And that's like could be a whole other hour, but you know, that's why these things are in place, because it's needed to protect the people. Like you were saying, the people that are living with HIV are much more likely to be victimized in any number of ways than they are to do anything that we've seen in the media. And like you said, it's literally just it's a piece of who they are, just like any medication that any of us take or anything that we've had or don't have or whatever. So
yeah, and I feel like I have been plugging the show Pose so much this month and like any other month, like not even just because it's Pride, but I just can't like, and I'm rewatching it, so maybe that's why it's like on the forefront of my mind, but I cannot like emphasize enough how important Pose is as a series. It's on Netflix. It's an FX series, so I think if someone like has cable, they should be able to access it like through there, or like, I'm not saying I condone like pirating or whatever, but whatever way that people access their shows, that's their business. But Pose is a show that's like, it's mostly about like the trans community and all the actors and like the producers and the writers. Like, it's about like trans people and it's about LGBTQ plus people, and it's made by LGBTQ plus people, so like it's amazing for representation. And what's interesting is like, even though it takes place during a time, because it takes place like in the 80s, so it takes place during like the HIV/AIDS epidemic, and like that was when there wasn't treatment and that was when people were dying. I think that like it does a really, really good job of destigmatizing it at the same time, and like it's just amazing. So I definitely think that like if people want to see a positive, not only positive representation of trans people, which is definitely needed. If anyone watched the watch party when we watched Undisclosed earlier, is it called? No, Disclosure. I keep calling it that. Disclosure earlier in the week. Check that out. But Pose is just like an awesome like look into that, and it like really destigmatizes HIV and stuff. And then I also I shared this during STD Awareness Week, but there is an advocate named Josh Robbins. I'll just read like this short little sentence. Josh Robbins is known for his role as an advocate for those living with HIV after coming out as HIV positive on Facebook in 2012. And something he said is, "I want people, both positive and negative, to find a piece of hope through my experiences." So meaning both people who are HIV positive and people who are HIV negative. And he's at I'm Still Josh on Instagram, Facebook, YouTube, and Twitter. And then he also has a website, and he's just like this awesome advocate, and he's like has TED Talks, and like he's super inspirational, and anyone like with HIV or not like can learn something from him. So I think he's really awesome for like breaking down the stigma.
Yeah, that is awesome. Thank you for sharing that. I was thinking when you were saying that, I was like, I can't think of hardly anyone. Like honestly, that, and then I'm really dating myself, but there was someone on The Real World who came out as HIV positive, Pedro Zamora. And he was a Cuban American AIDS educator. And he was one of the first openly gay men with AIDS to be portrayed in popular media. And if you can find the first season of The Real World, girl, you will be in heaven. Let me just tell you, you'll be in your 90s glory and just all the trashy reality TV you can handle.
Yes,
I love The Real World.
That's like everything.
But so that was
that's awesome.
Yes, so much. Like, and that was groundbreaking at the time for MTV. And I do remember some of this happening. But so there have definitely been non-negative portrayals, but it's just like anything else, you know, how hard is it for us to sit here and think when, you know, I feel like it's an illness that it just, I don't know. I mean, think of all the movies about all these different sorts of things that just the human condition, just that people live through. And I can't think of anything really that's, I mean, I'm sure there is if we look, and we will, guys, and we'll come back to you with good resources. But
yeah. Well, and Jonathan Van Ness from Queer Eye, they came out as HIV positive, and that was huge. So, like, there are like, even though the stigma I think prevents people from coming out as HIV positive. And right, so if someone's going through something, a lot of the times you want to look and see who's like me in the world. I need proof that I'm going to be okay and that this isn't a death sentence, that people will love me, that people will accept me. And like, it kind of becomes like cyclical, because if everyone is living under this stigma, then not a lot of people are going to speak out. So it can become harder to see yourself in others and to like overcome it. But because we're getting better status, and then that's how we lessen the amount of people with HIV, like, honestly. But I think we touched on everything that we wanted to talk about. We talked about a lot.
Yeah, I feel like we did a great job. I think the only other thing is really just like we said, just reach out to us if you have questions. And even just questions about things we said on here, questions about testing, questions about the privacy of it all, anything like that. I know any of us would be glad to answer.
Yep, yeah. Any of us at Health Education, you can like DM us on anything. You can like DM any of our pages and we'll get you in touch. So I'm just gonna go through a couple of these myth facts. Michaela, you can like stick around or you can like peace out. It's up to you. I'm just gonna do like a couple
I'll do
of
the
them.
myth facts.
Ooh. All right.
Yeah, let's get them.
So I'm probably just gonna go through we have like 15 minutes. So all right, number one. And if anyone has ever taken our class before, these all come from Be Proud, Be Responsible. So if you've taken our class before, I hope you are an expert. If not, that's fine. This can be a little bit of review. All right.
And
so
if you want to take our class, you hit us up because we'll give you the virtual pass.
Yes, we do. We this class is online. It's a virtual class. And if you complete it, and you can complete it on your own time, you can take as long as you want. If you complete it, you will get a $15 gift card. You have to be in Oswego County, but yeah, we will literally bring it to you. So that's, yes. Please contact us if you, or just go to our page because it's all like, yeah, it's all like listed there.
Perfect.
All right, so number one. Myth or fact? AIDS is a medical condition in which your body cannot fight off diseases. So is that a myth or a fact?
I mean, I feel like we hinted at that one. We'll see what people think.
Yeah, some of these we might not have explicitly gone over, but. Anyone? Oh, Kenzie made a comment about my shirt, so I do want to point out that this is a really cool shirt. It says, "The way I dress is not a yes," and it has like different clothing things. And I got this from SUNY Oswego from the Title IX office. So yeah, Kenzie had mentioned it, and I think it's just cool.
I have the same sticker on one of my planters over there. So yeah,
it's awesome. They have like stickers, pins, everything. It's so cool. All right, so does anyone want to guess if this one's a myth or a fact before I say it? Michaela, do you want to say it?
I am going to go with this is a fact.
Absolutely. So yes, AIDS is a medical condition in which your body cannot fight off diseases. Okay, Shai said her internet is lagging. You know, that just happens so much.
Everyone's internet comes on lagging.
Yeah, okay. That's okay. I know we're just coping with this whole, we're still getting used to, I know we're like 3 months into working from home and like virtual programming, but I feel like we're still all adjusting to it.
No, it's still changing daily.
It is. Okay, next one. AIDS is caused by a virus, myth or fact? And we definitely did go over this one. So myth or fact, AIDS is caused by a virus. And bonus points if someone can say what that virus is.
Ooh, yeah.
All right. Yeah, Cheyenne, you got it. It is a fact. So AIDS is caused by a virus, and that virus is HIV.
Mm-hmm.
All right. I'll do two more.
Okay.
Myth or fact, if you hug someone with AIDS, you can get HIV. Myth or fact? So myth or fact, if you hug someone with AIDS, you can get HIV.
Yeah,
Myth.
Jason.
Yeah,
But they
correct. That
used
is
to think
a,
this was true.
they really
Or
did. And some of,
they didn't know how it got passed, so they were
yeah,
just
yeah.
afraid.
So, yeah, so part of it was like genuinely they didn't know. And then it kind of
Mhm.
turned into like that stigma is kind of still lasted. And I
Mhm.
don't think that you hear this as often, but they would still like just basically use it as an excuse to like discriminate and just be mean, honestly, to people with HIV. But nope, you can absolutely hug and kiss and whatever, like someone with HIV. Like casual contact is absolutely fine. All
Yes.
right, and then this is the um, last one that we will go over. You can tell by looking whether someone is HIV positive. So this one kind of goes along with that one.
Mhm.
So you can tell by looking whether someone is HIV positive.
Crushing it.
Yes, that is also a myth. So you cannot tell by looking whether someone is HIV positive. That just goes along with like that whole stigma. And I guarantee you that you have not only have you walked down the street past people who have HIV and you have no idea, but you probably know someone or have met someone who is HIV positive and you have no idea because they can be completely healthy. All it means is that they like take medication every day. I feel like we were doing like a live podcast, like have it like the way we were talking. And yeah, so
Perfect.
oh, I also just wanted to say that if you go to our health education page and you like go to our pictures, along with Josh Robbins, there were a couple other like advocates, like information that we shared that are all about destigmatization of STIs, including HIV. So if anyone wants to like read that, a lot of them have like blogs or websites or like things like that. The STI project is a huge one. I feel like we share her stuff a lot.
Oh,
So
that one's
that was
awesome.
just still up on my computer, so I just wanted to plug that. And yeah, so we will sign off and hand it back over to the spot, and we will see everyone next Friday for another Health Ed
Yeah.
Power Hour. So,
Happy Friday.
bye. Happy Friday. Bye,
Bye.
Michaela.